Good morning, everyone. I'm Susan Cosgrove, and I will be your host for this episode of our live stream show, My Diabetes HQ Live. Happy World Diabetes Day to all of our viewers. Do you have a trusted go-to person for when you have questions about your health or your care? Many health centers, hospitals, and health departments use community health workers or promotoras to build relationships and meet the care needs of patients where they live, work, and play. Whether you need help navigating the system, scheduling an appointment with a specialist, refilling your medication, or if you're just looking for someone to chat with, CHWs are there to assist you with managing your diabetes. Today, our guests and panel will discuss how CHWs can empower you to be courageous in your care. Stay tuned. Our episode is coming right up, and you don't want to miss it. So before we begin, a gentle reminder that the content shared during the My Diabetes HQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Our weekly broadcast is developed and produced by Cities Changing Diabetes volunteers in Houston and in Philadelphia. Both cities are the U.S. members of a global network of 30 cities and growing, working to improve diabetes prevention, care, and management around the world. You can learn more about Cities Changing Diabetes by visiting citieschangingdiabetes.org. The purpose of the live stream is to help people with diabetes and their support teams, and today we're talking about the role that community health workers play in diabetes care and management. Leave a comment, share where you are, ask a question, and join the conversation. So to get us started, today is World Diabetes Day. Every year, World Diabetes Day on November 14th draws attention to important issues in the diabetes world and keeps diabetes in the public and political spotlight. Awareness campaigns reach an estimated 1 billion people in 160 countries. Thank you for spending World Diabetes Day with us at My Diabetes HQ Live. We are excited to have guests representing important medical institutions in our two Cities Changing Diabetes U.S. cities. So from Penn Medicine, so the University of Pennsylvania Health System has an incredible legacy of more than 2 centuries as the first hospital in the United States and the first medical school in the U.S. as well. Today, Penn Medicine is a world-renowned academic medical center in Philadelphia, with hospitals ranked among the nation's top hospitals and #1 in Philadelphia. And representing the University of Pennsylvania Health System, we have Lisa Kidd, a certified senior community health worker and a frequent viewer of our broadcast. And Lisa, we're happy to have you on as a guest. Welcome to the show this morning.
Thank you so much. I'm excited to be here. Happy World Diabetes Day.
Happy World Diabetes Day. So next, we have a representative from Harris Health, which is the safety net hospital for Harris County in Texas. Its 2 main hospitals serve approximately 1 million underinsured and uninsured people, nearly a quarter of the entire population of Harris County, the 3rd most populous county in the entire country. Harris County includes Houston, the 4th largest city in the United States. The system includes 18 community health centers, 5 same-day clinics, 5 school-based clinics, 3 multi-specialty clinic locations, a level 1 trauma center, a level 3 trauma center, a dental, and a dialysis center. Harris Health is a teaching system for Baylor College of Medicine and the University of Texas Health Science Center of Houston, and together they provide care to Harris County residents. So representing Harris Health, welcome back to My Diabetes HQ Live, Hope. We have Hope Galvan. I really enjoyed your previous episode about food insecurity and the food pharmacy program that you discussed with us previously. Welcome.
Thank you. Well, thank you. Super excited to be here.
And then, as always, we are joined by Serena Valentine, our fantastic My Diabetes HQ panelist and team member, the CEO of Core Initiatives and Houston's Diabetes Peer Support Initiatives Program Coordinator. Good morning, Serena. Happy World Diabetes Day.
Good morning. Happy World Diabetes Day to everyone.
So to kick us off, as I mentioned in the intro, we're talking about community health workers today. And so Lisa, I want to start with you as a certified CHW. So could you tell us a little bit about, what is a community health worker and what's your story? What put you on the path towards becoming one?
Oh, I love that story. Thank you, Susan. Community health workers are people who are caring people, people that want to advocate and just navigate resources and supports to make people healthier and aware of being empowered to be healthier. Within my journey as a community health worker, I started out in customer service. That's a natural field where you want to help people, give information, certainly feel trusted in your community of just wherever you are. And I came to Penn Medicine because of the opportunity to further my career and also help people enter the healthcare industry. And it's been an exciting entry. I've had an opportunity to meet a lot of people and change a lot of lives. I've been in that role for 5 years now. It'll be actually 6 in January. And everything that I've learned so far has been a way to empower people, make them feel confident in how they're handling their health, asking the right questions, and feeling that they can feel better in their community. So I will say I'm a little bit nervous, but I'm going to continue because it's a job that I love. It's natural to me. I come from a lot of helping the community as far as volunteer organizations and working with even certain political organizations as well to promote good health in the community. And with respect to diabetes, that's a really prevalent disease in most communities. And I myself am a patient of diabetes. So this is a way for me to learn and grow and help the community as well.
That's great. And certainly, when you talk about being a community health worker in your journey, like your passion for that really comes through. It really shines through that this is something that you're passionate about. And I think it's great that you highlighted kind of your experience as a customer service rep, kind of bringing that to this role and how you serve others as a community health worker.
Yeah.
Could you talk a little bit more about, what a community health worker is and what a community health worker does?
Yes. Actually, a community health worker is a healthcare professional. We work side by side with clinicians and within health systems, primary care offices, and in the community to ensure people are getting the tools they need to stay healthy in the community. So we actually go to any type of resource that a person may need. If it's a social need, we also go with them to appointments. We do interviews and things of that nature to help them understand what are the questions to ask, what do they need to advocate for themselves. And then we also work with clinicians to help them understand what's going on with the patient. Many times what they're seeing, what's in their chart may not be what's actually happening. They may not know that the person is sleeping on a couch in someone's home because they don't have somewhere to live, and that's why they can't keep their insulin cold in the refrigerator. Or maybe, there's not, they're trying to get benefits, trying to get medical assistance, or trying to get Social Security disability. And that's what they're struggling about. And that's why they're not taking their medicine. A community health worker kind of cuts through some of the confusion and levels the playing field. So now we're talking to the doctor, we're talking with the patient, and we're making a plan for a better outcome.
That's great. I think really important to highlight the role that community health workers play as a member of the care team and the way that they can really enhance care through that relationship with clinicians. So Hope, I want to ask you, so the theme for World Diabetes Day this year is actually the nurse in diabetes and the crucial role that nurses play in supporting people living with diabetes. And so Lisa started to touch on kind of how community health workers can work with different clinicians in the care team and really be integrated into the care team to meet the needs of people living with diabetes. So can you talk a little bit about, as a nurse, kind of how you work with community health workers and the role that they play at Harris Health?
Sure. So Lisa, I think she expressed everything so well because it is about customer service. It is about linkage. It's about engaging with that person with diabetes. So at Harris Health, our community health worker program works really closely with the diabetes educators. The diabetes educators are registered nurses. They take care of the patient or help take care of the patients in the clinics. And so the community health workers at Harris Health, they actually go out into the community and visit the patient in their home. Of course, this is pre-COVID, so we've had to make some adjustments. But it's really being able to connect with the patient at the level that, number one, they're in the patient's home. and then bring it back to that clinician who is helping manage the patient for their diabetes, whether it's, helping find out what exactly is going on in this person's home. I mean, what do they have in their pantry that maybe they're not expressing to you when they come into the clinic? But when that community health worker engages with them, speaks their language, comes into their home, they get all of that wealth of information and they bring it back to the clinician who can then make those appropriate adjustments instead of just going under the assumptions of that, we think they have enough food. They're okay. They can manage their diabetes. So it's really that connection that the community health worker can do that sometimes us as clinicians, we may not have more than those 20 minutes that we're with them or those 30 minutes, or maybe they don't really know if they can, trust us. I will tell you, in some cultures, a nurse, a physician is seen in a certain level that maybe there may be that kind of, I want to just be yes, I'm doing everything. But when the community health, it's like, oh my God, you have diabetes, you understand, you're in my home. So I think it's a lot of that. It's really that connection of us as clinicians trying to be able to do everything through medication management, some diabetes self-management education, but bringing in this person who connects with them and sees what's going on in the home and can speak their language is how we see it.
Yeah, I think that's great, highlighting the importance of like a community health worker in like meeting people where they are at, right? And kind of being that linkage and providing that connection. And Serena, I would love for you to jump in because I know that's a big part of what you do as well in peer support, and would love to hear kind of what your experience is in kind of empowering people who are living with diabetes by meeting them where they are instead of in a clinical setting.
Yeah, sure. Susan, they have people who are dealing with diabetes don't often like to talk about it. They may talk about everything else, but they don't really want to talk about diabetes. So when they meet someone like me who has diabetes and is in a position to maybe kind of help them or direct them where they need to go, then they become more comfortable. And so I know me just listening to what a community health worker does, it's like I need to go ahead and get certified because we do that as well. But it really impacts the patient especially when you're dealing with a chronic illness like diabetes. You don't feel like you're alone. You feel like there's someone there that can hold your hand and help you along the way. You feel like even the other things that you have dealing with, such as like the social determinants of health, like, the food insecurity, not being able to pay rent, not being able to pay any other bills, living from pillar to post, this person can actually help you with that as well. And so you can go to one person and get maybe not all your needs met, but you can get direction. That's a big help in your diabetes management.
Yeah, that's great. And so Serena, I just want to pick up on something that you mentioned about how, the work that you're doing is very similar to what a community health worker does and how you might be interested in getting certified yourself. So Lisa, tapping into your expertise as a certified community health worker, what would you recommend the first steps that Serena take would be if she wants to become a certified CHW also?
I think that's a great idea. We need more community health workers, right? And so one thing I think is interesting now, because of the climate and the way that people are really trying to deal with the social determinants of health, there are lots of organizations out there and mentorship programs that have started for community health workers. And a good start would even maybe to reach out to the National Association of Community Health Workers. Even through the American Public Health Association, there's a community health worker conference within that organization. So there is a groundswell of information out there for people that want to be community health workers. Even in most public health systems, there are people who are sort of community health workers, navigators, guiders, if you will, who are helping people, because usually that's who it is. Somebody in the family that you go to, there's a go-to person on the street, the person with the resources, and just try to get into something that is bringing you towards the healthcare industry and helping people in your community is a really good idea. And even researching public health initiatives, things of that nature. Once you get into the program, then there are training opportunities. I know within Penn Medicine, we have an extensive program through Impact, where we're training community health workers all over the country. So it's definitely a way to get in, and a lot of people are focusing on it currently.
Yeah, I think that's great advice. And I think that there definitely are a lot of resources out there from different professional associations. I know in Philadelphia, I think every major academic medical center kind of has their own training program and their own pipeline for CHWs. And as you said, Lisa, they are increasingly viewed as an absolutely critical member of the care team, particularly for people living with diabetes.
Yeah.
So let's talk a little bit more, and Hope, I think you started to touch on this with sort of how Harris Health is using community health workers. We know that community health workers can help people that have sort of any number of diseases or conditions or are dealing with social determinants. But what are some specific things that community health workers are doing to support people who are living with diabetes in Harris County?
Sure. So for our program, the community health worker, it's a home visit program. And as I mentioned earlier, COVID has kind of made a little bit of a turn for us being able to go into the home, but we are adjusting, and we'll talk about that later. But the whole purpose of the community health worker is to engage the disengaged. So the patient, the person with diabetes that we're working with is perhaps somebody who has come into one of our facilities but hasn't returned. But we do know that they may have a hemoglobin A1C that's elevated, greater than 9. And so for the community health workers at Harris Health, it's very much about going out into the patient's home. We do a diabetes knowledge questionnaire while we're there. We look into, does this person need assistance with navigation of the system? By that we mean, do they have they applied for the financial assistance that we offer? Do they know the importance of going to go visit a nurse patient educator related to diabetes? Do they know about the registered dietitian who provides, what does she do for their diabetes? And as I mentioned earlier, really, looking into the patient's home is like, what do they have? And of course, with the patient's permission, of course, we develop that relationship. What do they have in their pantry? What do they have around them that maybe gives us some cues of what exactly is happening in the home? And then also the piece about the community, in this person's community, are they taking advantage of some of the resources that are already out there to help them manage their diabetes? So it's a little bit of everything, as as we mentioned earlier.
And so then it sounds like for Harris Health has a way of identifying patients that they think would benefit from seeing a community health worker, and then you're doing the connection on that side. So Lisa, can you tell us, does it work similarly at Penn Medicine, or how are you identifying the patients that would benefit most from being connected to community health workers?
So previous to COVID, we were meeting patients either in the hospital as they were about to be discharged, or they were met at a primary care clinic. And the folks that were met in the primary care clinic were usually introduced to someone from the research team and targeted as someone who may want to lower their A1C, and they have a goal to do that, or maybe they were newly diagnosed with diabetes. So they would have a community health worker for 6 months. And that community health worker would work on the goals towards lowering the A1C, but also as the patient as a person. Do they need help with social services? Do they need help with insurance? What is something fun they'd like to do? Maybe they want to go bowling, or they want to go, we have the veterans have a community garden. We like to build around things that are not just focused on the disease or the that part of the medical end, but who are they as a person? We actually spent 6 months as a long time. I was dealing with patients in the hospital. So maybe they're about to be discharged and they had some chronic illness, heart failure, or something of that nature, and they need some support. So I'm with them 3 months. Wherever they go, I go. If they're going to the shelter, if they're going somewhere. And that was from a target list from our research team. Now, we do get referrals direct from the health system. So someone will say, I think a community health worker will help this person. So, we'll go and see that person too. But usually we go right into the hospital room. We work in the hospital. Now, because of COVID, we're working remotely. So we're actually pitching out to people. We're still getting referrals from the health system that may have been affected by the virus or not, still is uninsured or underinsured, has some social determinant of health issues. And we're with that person anywhere from 2 weeks to 4 weeks remotely. And we're still doing the same type of work. I've got people tested for COVID. I've helped people get unemployment. I'm sending a lot of people those find a word puzzle books, something to take their mind off of this. And also, how do they feel about social unrest? Were they able to vote? Did they need to register to vote? Okay. Do they need supplies? There was some unrest right in Philadelphia. Some people couldn't get medicine, so we had to activate, find the medicine, things like that. We're like boots on the ground. We turn into what we call first responders. And where we used to just deal with certain parts of Philadelphia, now we're in the 5-county tri-state area, all remotely. So it's really intense. We're like, I always say, I'm on the front line in my living room.
Yeah. Front line of your living room. I think that is a great way of describing kind of the way that you've been effectively working remotely. And as you said, you brought up, that not only has COVID changed the way that you work with patients, and that a lot of that is happening virtually or remotely, but it's changed, it sounds like, what the patient's needs are. And it's put community health workers kind of front and center in terms of making sure that all of the various needs that people are encountering now can be met, so they can be healthy and kind of maintain their health. So Hope, I think that you have alluded to kind of the way that COVID's impacted your work as well, and the way that you're working. So could you go into a little more detail about that?
Yeah.
Sure. So as I mentioned, when we started the program, it was very much about the person going into the community health worker going into the person with diabetes home. What we've had to do is start doing the telehealth piece. So we've kind of changed the model a little bit. So now for our patients that we can't go visit them, we still do the outreach via telephonic. Once we engage them, we do offer them a video visit. And the video visits are structured, and I think there might be a slide on this on how we do that, but we've become central to engaging the patient through a video visit through telehealth. We connect them to the patient educator for diabetes self-management education. And then we also connect them with the dietitian via telehealth for the nutrition education piece. And so one of the things that we do too during those video visits and the virtual care is everything that we were doing in the home, from the diabetes self-knowledge survey to the how are you, food insecurity screening, addressing some of those social determinants of health, is happening virtually through a telehealth visit. And by telehealth, again, it could be telephonic, it could be a video visit. When we were in the home, the way we did it is that we would take our iPad into the home and then connect them that way. Now, because we can't go into the home, we call them. And then, but we still do the connection and we still do the appointments for those video visits with our ancillary staff. So, and one of the things I will say that when we first started with telehealth, of course, because of COVID, we did have some barriers, and even from just some of our partners that said, our patients don't know how to use these things, or, they're not going to be able to do these things. But, what I always pressed on with virtual care was that we don't need to have the person come into our clinic to receive education. We don't need to have to just kind of say, well, we're not going into your home. We can't do this. Let's walk our patients through virtual care, hold their hand, let them know that if you use this modality, you can connect to a community health worker, you can connect to your physician, you can connect to your patient educator, you can connect to your clinical pharmacist. But because of our role, it was you're a community health worker. You have the time to walk them and hold their hand through this. And they did. And it's just been such a success. I mean, our numbers have just skyrocketed in how many patients we're able to actually touch.
That's great to hear. And I think, thinking about the role that community health workers can play in bridging that digital divide, which is something that we increasingly see, is that sort of as services are going virtual, the patients who need to access those services the most might also be the ones that have a hard time with going online, with making sure they have the access, the equipment, the knowledge that they need.
Right.
And Serena, I know that you've talked before too about how you've taken your programs online in the era of COVID. Do you have anything to add in terms of keeping people engaged, when you can no longer do things face to face?
Yeah, well, for the most part, before COVID, I had in peer support a lot of the older adults. And so they will more likely do in-person face-to-face than a virtual meeting. But you have some that are tech savvy and they're like, oh, this is great. I can be at home and don't have to leave the house and I can still come to a meeting. So it just all depends on the person.
Right.
Like I always say, for peer support, sometimes we may have 10 people in peer support, and sometimes we may have one person or no people. It just depends because there's a lot of things going on right now. And, I'm just making myself available for people if they need me. So, yeah.
That's great. Yeah. So Hope, I want to kind of go back to you and talk a little bit about, how you kind of prepare your community health workers to take on this role. And, Lisa, you talked also about how community health workers, my impression is just that they do everything, is that they can handle anything that's thrown their way, and that, they really are able of handling all patient needs. So Hope, what are you doing to strengthen your CHW's ability to kind of play that role?
Yeah, sure. If we can put up the slide on some of the onboarding that we do, it's very intense. So one of the key things is that, we have the organizational onboarding. By that, we mean, everything Harris Health. But we also, part of that, we do the department, which we provide motivational interviewing training. We let them know every single integral piece related to financial assistance, because of course, at Harris Health, we do serve the uninsured and underinsured, so we've got to make sure that they always stay funded to some degree. So we walk them through the financial assistance piece, so that way they can become good champions for the patients. We also talk to them about social determinants of health, because, for the community health worker, being in the community, we want to talk about the social determinants of health, because then we start talking about utilities, transportation, food insecurity, kind of give them a little bit of structure so that they at least know that all of these little social determinants of health are things that are meaningful and impactful to the patient's care, right? So we do structure that program. The other thing that is very critical is the mental health first aid, because of course, any person who has any kind of mental health situation going on, they're not going to be in the ideal state for education or navigation or anything that we may want to do. So the mental health first aid is very critical as well. And even just for the community health workers' safety. Another thing that we do is part of the training is that we do have them shadow here's a little bit more information on the community health worker staff training. So the home visit safety program, as I mentioned before, TeachBack, we use teachback.org for that. The diabetes 101, chronic disease. So it's all very explicit here for all the different onboarding that we do. And then once we do the onboarding, we very much have a reference guide that they can use at any given time, because of course, it's a lot of information to absorb. But I think the most important piece in any kind of training is not only offer them the education and the skills, but also so that they can go and be able to be champions for the different services that we offer within the organization, is to be shadowing. So they go shadow the dietitian, shadow the patient educator. We're working, I hope at some point we can go shadow a clinical pharmacist, but all the different services that we offer so that way they can speak well to it. So hands-on education, training through shadowing, and then they always have a reference guide that they can go back to be able to answer some of the questions that they may or have. Yeah.
That's great. So it sounds like you put them in a position where they have the knowledge, but also like the hands-on experience to really understand, the different care team members, kind of what their role is. So Lisa, do you want to talk a little bit about kind of the training or support that Penn Medicine provides CHWs to kind of prepare them?
I was looking at those slides. I'm like, it's very similar to our program. We had the hands-on training piece. We have a portion of it where we have different organizations that will come in from around the city to talk about the financial aid aspects, the resource aspects. We also get a lot of support from the health system as far as how to integrate with the care team. So some of us will maybe go on rounds with the physicians or have certain groups. The cardiology group may want to meet with the community health workers to see what's going on in heart failure or things of that nature. So we do work very closely with the health systems and with our colleagues. We also have where we mentor the new CHWs with lead or senior CHWs. Safety is a major part of how we do our job. Before COVID, we did not go to someone's home alone. We always had to have a buddy. We had to text in and out. We had to make sure that if we did see a person, it was in public. We had different notes and documentation. There was an issue because we didn't discriminate on who we worked with. We had incarcerated patients. We have patients that are in facilities, things of that nature. And so we work very hard for safety so that we feel safe in our job and our patient feels safe in working with us. One thing that we also do is a part where we do some actual teaching training. So within the med school and within the a nurse practitioner school, we actually have those people shadow us. So we're helping train new clinicians, new providers on how to deal with the community. What are the social determinants of health? They actually see them because they're there with us in the home sometimes. So it's a lot about teaching as well. There's a teaching school and teaching institution, but we try very hard to make the community health or health worker know that they're a colleague, they're a professional, and people will respect and want to work with them because they're that professional, and you feel empowered to really, you're listened to, you're heard, and you feel like you're a part of the care team, which is a big part of how we're trained.
Yeah, that's great. And I think, one of the things that is really that source of strength for a community health worker is that dual role as a member of the community, that level of trust, that familiarity, as well as kind of a full fledged member of the care team as well. So Elisa, could you elaborate a little bit on, what it means to be embedded in the community and kind of how that influences your ability to work with patients and kind of the trust that you can build, from serving in that role?
It's probably the best part because, like I said, I am a patient, but I'm also a member of the community that I grew up in, that I was born into. And so I look like my patients. I have some of the same issues as patients have. I know what's nearby, what's comfortable, what's open, what's closed, and I can bring that knowledge to helping my patients as well as my colleagues. We share information with each other about how to help each other and how to help our patients. So by me knowing what's functioning, what's not functioning, having a network through just living in that area, I know where the markets are, or I know where where people usually congregate. Like sometimes I have patients, I lose track. I know they may hang out at this park or they go to this shopping center. I can't do that so much now, but it does still help. Even when someone's giving you their address, they may say, I'm at 1919 Mockingbird Street. Oh, that's right near 58th and somewhere, so it lets them know, hey, I'm with you, And that means a lot because a lot of times the people that are in the health system may not necessarily look or sound like the patient,
Right. So Lisa, I just have to say this because I love everything that you're saying, and you're absolutely correct. One of the things that I saw with Cities Changing Diabetes was the starting of and strengthening of the faith-based piece of diabetes education, right? But it was, also the community health worker piece, because as you said, as clinicians, we're so good about, do this, don't do this, don't do that. Because in our head, and I'm a nurse, right? And so in my head, I'm thinking, oh my God, you've got to take care of your foot. But, and so I'm so preoccupied about, you're not taking your metformin, you're not taking this, and this is what's going to happen. But you guys do the job of saying, okay, Mr. Galvan, Hope told me to come talk to you. So what's going on? Tell me. And then they're like, you're a person with diabetes. I've had gestational diabetes. And when you tell them that, I hear you, I was on insulin 4 times a day when I was pregnant. Yeah. They're like, you were? It's like, so yeah. So all of those people that you just met, I just have to say that I just love Lisa, because this is why I love my community health worker program so much, because of that critical piece. So it's just, you give me chills. So
thank you. I just love it though.
Yes. And Serena, would love for you to jump in here too about how, those relationships with community members, with other people living with diabetes. And Lisa, I think you articulated it previously when you said, like, we are our patients, and sort of how do you see that playing out?
Yeah, sure. So I have my hey girl, hey moments with some of my participants. It's like, oh, Miss Serena, today my sugar was high and I don't feel good about it, or I'm having nerve pain, and or all the different things that can happen in a day dealing with diabetes. I'll be like, girl, I know what you're talking about, because yesterday, blah, 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 blah. It's like I can always identify with what they're dealing with, and it makes for a great conversation. And again, it builds more trust with that person. So it's just, and sometimes you hear things yourself that you didn't know. People come to you as like you're the expert, and then I'm on the cool. I'm just kind of listening, like, oh, okay, I'm listening to what you're saying because I need that information for myself. I didn't know that, So it's a learning. It's a shared learning. It's not I'm over you. I know more than you.
Right.
I just want to help you with what I know, and in the process, you can help me with what you know. When you set that field at level where it's not one person is over or below the next, then it makes for a great relationship, a great collaboration with someone's life to help them with their diabetes management, because both of you all are dealing with diabetes management, and so you can learn from each other.
Yeah.
Good.
Right.
Yeah, that's great. And Serena, I love that you use the word collaboration. And I think you made some really great points. And Hope, I think you pointed this out earlier too, is that, ideally, I think every healthcare relationship is collaborative, right? Your relationship with your physician, with your educator, with your nurse, like in an ideal world, that's all very collaborative. But I think there are just a lot of factors, cultural factors, other factors that do make people feel like it's very hard for them to get on the same level as some clinicians that they're working with. And I think what we're hearing today is that community health workers play such a critical role in breaking through that like sense of hierarchy when someone's engaging with the healthcare system, and really saying to patients, to people who are living with diabetes, like, you are also a member of this care team. Like, you are also an expert. You are also, bringing wisdom and knowledge to this relationship that we respect, and that's a really critical component of getting the care that you need. Yeah,
very much so.
So I want to talk a little bit. I think that we have kind of talked about this somewhat, but want to delve into the different ways that community health workers do help address the social determinants of health, address some issues like institutional racism in healthcare. What type of work are you doing to help break through some of those issues that really contribute to inequities in our healthcare system?
Which one?
You want to start, Lisa?
Really us just being there, being in the room makes such a difference sometimes. Because many times, like I know when I would meet people even in the emergency room, they were sick, they were struggling with something, and it just kind of let everything kind of clear out, because I don't usually wear scrubs, and I don't have the white coat syndrome going on, so I could be just that time right there in the room to make a difference. And I've had patients who really struggle with how to speak with their provider, or what their provider may have said to them. And I've actually pulled providers outside of the room and said, hey, there's some other things happening here, and this is what I've observed. And I had the patient's permission to share, but sometimes you kind of have just like a little sidebar to maybe get a point across, or maybe a different idea presented, more to help the patient. Just being there makes that difference. And then too, as far as the social determinants of health, usually if I go to the welfare office and someone's giving a patient of mine a hard time about something, a lot of times me being there and saying where I'm from kind of smooths things over, because that can be a tough situation. Not everyone is as user friendly as they could be sometimes. And this kind of levels the playing field to have someone in there. And it kind of makes the patients sit up a little bit better because they got somebody there. A lot of times people said they would help these people and they didn't. So that trust gets knocked down tremendously. And once you put in a community health worker, someone say, hey, I'm right there with you, it does make a difference. But it's also very challenging because, you got to think of your own self-care too with this whole thing, So you got to have a pretty tough exterior to deal with things at sometimes, but you usually know the ins and outs. Maybe that the grant applications for heating assistance is going to open up November the 2nd. And you talked to this patient last month, hey, we got to get this application in. Or maybe there's a food source that may help someone. And, before I would actually go and stand in line for people to get food or get what they needed if they couldn't get there early enough, So you're like, meet people where they're at, understand what the needs are, and really together you work on a goal. Like, you're looking for housing. That's a real hard thing to come by in Philly, but I know where they're taking an application. This place just opened up. I can go with you here. I have a connection. So you're constantly using your critical thinking skills to figure out how we're going to do this together.
That's great.
Yeah.
Yeah. Hope, do you have anything to add?
Susan, Susan, I think for the social determinants of health, Harris Health System, just because of the patient population that we serve, has, they've really pushed us to the next level. And by us, I mean the leadership teams, into really helping create programs that address, social determinants of health. And one of the programs that I think you saw the episode that I did regarding food insecurity. That is one of the priorities for our patient population, and being able to have the community health worker work in our food pharmacies and be able to provide a diabetes self-management intervention at that moment, connect with the patient who is food insecure and has diabetes in our food pharmacy, but also connect them to that nurse patient educator and dietitian, as I mentioned earlier, just by being able to engage with the patient, right? Patients will express food insecurity, when they come into our clinics, and historically they would get a passive referral. Now it's like, they walk down a few steps and their food pharmacy is there, but they're also greeted by a person who is, like Lisa said, they're not in a white coat. They're friendly. They're like, hey, we're here to help you, come on in. How can we do this? And then they take it further by screening and doing some of those things related to other social determinants of health. So the community health worker at Harris Health is very much that. It's the person who is helping us get to know more about these social determinants of health that are sometimes our patients with diabetes are not expressing, and then being able to connect them to the real life resources that we either have on site or through the community collaborations that we have. One of the things that we did with connecting with the Houston Food Bank is really just start telling our community-based partners that, we need more help. The community health worker knows everything about the community, but now we need the community to know everything about the patient population that we serve, right? So it's two ways. So for the social determinants of health, for us, food insecurity, transportation, the mental health piece, because I will tell you, some of our community health workers are actually in our emergency department working with the patient who has a lot, they've been regularly visiting our emergency department. And maybe it's a mental health issue that we need to address that we never have because we're trying to move them through the emergency room. Or maybe it's they get stuck in one little piece of trying to get financial assistance, access to coverage that no one's walked them through it, but yet they keep coming into our emergency department because you know what? It's a one-stop shop. They'll do what they need to do now, and then I'll be back the next time I need them. Instead of thinking about, what other resources I have available. So that's what the community health worker is great at when it comes to the social determinants of health is, identifying, connecting, whether it's at a community or an organizational level at Harris Health.
That's great. Yeah. So Lisa, you mentioned something that I want to come back to, which is, the idea of self-care and kind of what you do to take care of yourself as a CHW, knowing that, you're in the community, you are, your passion for your work comes through, but it can be like very heavy work, I think sometimes, and very intense. So, would love to hear from all three of you, kind of what you do for self-care, what you do to stay motivated, kind of how you're caring for yourself as you care for others in the time of COVID. And Serena, I think I'm going to start with you for this one.
Starting with me. Okay. Where do I start? No, for me to help someone else with diabetes, I have to help myself. And the only way to tell someone else how to do it is to try it myself. So I do take time to myself when I can. I do have a son, 11-year-old, but I do try to take time to myself. I make time to exercise. If I have to get up extra early in the morning just to make sure I do everything I need to do, take my vitamins, take my medicine, check my blood sugar, all of those things. And a lot of times after a series of maybe some peer support meetings or things like that, sometimes you hear some things that you're like, oh my goodness, I can't imagine going through that, or I can't imagine dealing with that. Sometimes you hear things that kind of get you down because you're such a passionate person, you love people, you want to help. And then there's sometimes that you want to help that you can't help. And that makes you feel bad too, even though everybody will say, oh, well, no, you can't help everybody. It's like, why do you think I'm here? That's what I'm trying to do, So it does make you feel a little down sometimes when you can't help everybody, but you just have to sit back and realize, hey, I'm here to help who I can help, and whoever I can't help, I will just lead them in a direction to someone who can, and try your best not to let other people's problems in your, space, because that can get kind of hard to do too when you hear a lot from people, and when people start to trust you, they'll even call you or email you more. Or I get messages on Messenger in the middle of the night, like I'm serious. I get this stuff in the middle of the night, but I get up and answer because I know how they feel. So, but you do have to separate. This is what I do, and then I need time for myself because I have to be good enough to help other people. So, yeah.
Do you want to add anything?
I agree. I was just like, yeah, because I will go overboard. I used to belong to different organizations, and I volunteered. And when I first started this job, I couldn't do that. Because I'm like, I do that, I get paid to do it now. But I could give all day, but I have to set boundaries for myself. And even when I have patients, we say we're with the patient 2 to 4 weeks. So I say it in the beginning. When we get halfway through, I'm reminded, and then when we get closer to the end, okay, and then it's time to validate. Yeah, we did this. We got a new PCP. You started riding the bike again, or we were able to put in an appeal for Social Security disability. So these are the accomplishments, and that's important for me and for the patient, because part of my job is to empower them. So I can show them by example and working together, and then okay, we've got to move on, But I do sometimes worry, like, well, what happened with the patient? Where did this patient go? And I do get callbacks, but I really have to think about me. That's important, because you can't give from an empty cup, right? And the one thing that has been really good for me is I adopted a little dog that I love. And I never wanted a dog. So now I have this awesome new coworker that I love and takes up a lot of my time. But that's good for me, because I have someone, it's just me by myself now. So I have that person, that doggy with me. And I don't get to go out and work as much as I did. So I used to walk and catch the bus all over Philly. So I've been trying to work a little bit more efficiently. I'm doing some things that my doctor recommended. I got the stretch bands and things of that nature, because I have to maintain my diabetes. I can't afford for my A1C to get too high, and I'm sick and I can't work, So I feel like, because I work for a health system, I kind of got to walk the walk and talk the talk. Not saying that I'm really, great about it, but I think differently now, because I have to think of me. I make sure I take my medicine. I keep my doctor appointments. I get my blood work done. And that's important. I have to talk about it and be about it.
Yeah.
That's great.
I think, Lisa and Serena, as a leader for my team, one of the things that the director and the manager are wonderful at is that, every meeting is started with an icebreaker. Like, hey, something fun, something exciting to take away from this. The work that we do can be not only exhausting, it can be emotionally draining, because if you think about it, we're working with the patient population that is so limited on resources, no insurance and some of those things. And if you don't have that self-care, you then start looking, you start looking at getting quantity and not quality, right?
Exactly.
And so I always use those words with my team, which is, I need quality and not quantity. So if you are not healthy, then that impacts our patient population. That impacts then the organization. So I walk through that with them to say, if you need a day, call me. We're here for you. We're in this together. So because the last thing I want to see is passionate people stepping away from something that they love because they're so exhausted and so emotionally drained. So, we make sure that we always tell us, like, hey, look, I know it's challenging. I need you to understand that our goal as community health workers is to empower the patient, give them the self-management skills, education, so that then they can take ownership of their chronic disease or what they're working with. Because I will tell you that we have to graduate patients, and sometimes some of our patients can be more challenging than others. But for the patient that you're spending 90% of your time with, there's 10 more that are just salivating for you to come help them. And we don't get there because we're trying to sometimes take on the parent role. So again, it's a combination of everything that Lisa and Serena said. But as a leader, I will tell you that I'm very open about, come talk to us. Tell me what you need. How can we help you so we don't lose you? Because our team is very passionate about what they do.
Hope, I'm so glad you brought that up, because I did want to mention, it does help that the organization that I work for cares deeply about the people that work there. So we have certain caseloads, we have certain ways that we can use self-care time for ourselves, and we check in. We can actually talk with them and say, hey, this is going on, that's going on. And we're each other's community health workers too. So it means a lot that you have the support of your organization that recognizes the need for that.
Yeah.
Yeah, I love all the different ways that, all the different meanings of the word community that I think are inherent in community health worker, right? Like you're in the community with the patients. And as you just said, Lisa, like you are each other's community as well, which is incredible to have. That's great. So I think we're approaching kind of the end of the hour. So want to start wrapping up here. But I just want to ask, I know, Lisa and Hope, you are both affiliated with health systems. Do you have any recommendations or thoughts for our viewers that might be thinking, this sounds great, I'd love to get connected with a community health worker, but I'm not really sure how to do that? Like, how could people find a community health worker program locally that they could connect with?
Well, if they're in Philadelphia, they can reach out to me. And I'm also a member of other organizations around the country, so we can always do that. But what I always tell people, what I usually do is I Google. I just and I just start wandering around until I find what I'm looking for. But no, like I always just say, there are institutions and organizations around the country, and most health systems, and a lot of universities and med schools have community health worker or community health worker type programs as well.
Yeah, I second that. Lisa, you stole my words because I was like, talk to me. We have a great department, but agreed. Association, the Community Health Worker National Association, there's different chapters, might be a good start. But I will tell you, as an organization, Harris Health, we do hire community health workers. We do a lot of the self-training. But again, there is a local level chapter that you can always look into it wherever you live.
Yeah. And I will even add, we actually at the Penn Center for Community Health Workers, we have a website, and we also have a toolkit online for people who may want to start a community health worker or enhance their program, or are just looking for resources that are on our website as well.
That's great. Great. So in our last few minutes here, I just want to end by inviting each of our guests and panelists to share kind of their final words of wisdom, key takeaways, anything that you really want our viewers to come away from this episode knowing or doing. And Lisa, I'll start with you.
I just want to thank you guys for having me on this episode. And I just would want people to just feel empowered, just feel that, it's your health. It's your body, and it's your life, and it's important enough to care about how you're treated and what you're treated for. So, and in the way for diabetes, that's important. We know people that have diabetes are more susceptible to maybe contract COVID. So it's very serious. I know in Philadelphia, there's a rise in amputations. There's a rise in childhood obesity. So all of these things are things that we want to try to attack and make less of, and have healthier people. So get involved in your care. And there's probably someone that that could be your community health worker yourself. But I thank you all. But I really just say people feel empowered enough to help your decisions get better.
Great. Serena, any final words of wisdom from you?
Just ditto, Lisa. No, but don't feel like there's no one out there that will help you. And there are people that I see all the time that have been through many different systems, healthcare systems specifically, and they feel like, well, they're not gonna, nobody's gonna help me. If they're part of the system, they're not gonna help me. But there are people out there who care. Yes. So just keep searching, keep looking, because they're out there. We're out there.
Yeah. And Hope, we'll give you the final word this morning.
Yeah, sure. So in connection with the theme for World Diabetes Day, to all my colleagues who are nurses, the theme for this year is really how to raise awareness around the crucial role of the nurse in diabetes self-management and diabetes supporting. So that said, the role of the nurse is critical in diabetes self-management education. For the community health workers, we are your partners. For our patients, you are not alone. There's a lot of passionate people out there that want to be here to serve you. So that's it.
That's great. That's a great note to end on. Thank you all for being with us this morning. Thank you to our viewers. It's been a great start to the weekend with yet another talented panel of our guest speakers. And we hope that this conversation has helped our viewers understand how community health workers can support your diabetes journey. And we hope that we've maybe even inspired some people to become community health workers themselves. We'll check back with you, Serena, and see how you're doing on that in the future. So mark your calendars, everyone. We'll be broadcasting every Saturday, 10 a.m. Central Time, 11 a.m. Eastern Time, and our next episode will air on Saturday, November 21st. We will hear from our panel and guests from Jefferson College of Population Health, and they'll be discussing the diabetes prevention program and some of the diabetes prevention efforts that are going on in Philadelphia. And then in addition to this being World Diabetes Day, it is also an important holiday. So before we leave, I would like to send a special happy Diwali greeting to all the special people who contribute to making MyDiabetesHQ Live a success week after week. And that includes Dr. Ajay Rao from Temple in Philadelphia and 3 generations of Vermas in Houston, Kamla, Umesh, and Reva. May millions of lamps illuminate the lives of you and your family with endless joy, prosperity, wealth, and good health forever. So thank you, everyone. Thank you so much for being part of the MyDiabetesHQ community, and we'll see you next week.